Hello, it's me, Dr. Nampes, and I'm in my hospital on duty. I went out for a walk, and during my walk, it came in my mind to make a short video on the use of the paracetamol. Paracetamol is one of the most commonly used drug in our settings, and here I was with one of my colleague. She is walking with me right now. She is across the road there, and the video that I'm making, just I got influenced with the daily use of the paracetamol that is commonly used in our houses, and most of the practicing nurses and staff, they don't know about the proper use of the paracetamols. And it is one of the drug that is commonly available over the counter. Everyone can easily get it from any shop or any medical store without any prescription. In most of the cases, when someone is taking analgesics for the use of headache, for in case if you have headache and you are using constantly, even every second day, and at least for a 3 months, then you can have mo is what it is: medication overuse headache. Medication overuse headache. M for medication, O for overuse, and H for headache. As a result of that, what happens when you are overusing paracetamol, it can affect your liver and kidneys. I can easily give you some of the examples from a practical life. Whenever someone is taking too much of the paracetamol, either for the joint pains or for any issues, they certainly have either acute liver failure or acute kidney failure, or both together. So one must be very careful if you have medication overuse headache, or you are taking the paracetamol excessively for joint issue or any issue. Must consult your doctor if because whenever you are taking the paracetamols or any other analgesics in overdose, what happens that your body get used to it, and it doesn't respond to the same quantity of the medicine. Like if you're taking two medicines, then you need maybe four medicines to get relief for the same quantity of the pain. So it is very important that you follow the doctor prescription. Do not ever try to take excessively these medications, because it can badly affect your health. Now let's talk about what happens in our daily practice. Most of the practicing nurses and doctors and physicians, they don't know that if they are looking for the drug interactions, like we miss it in our busy schedules, or sometimes it is not even in our minds. But let's talk about the very commonly used drugs, the commonly antiemetics that we use in our practice, in some of the common drugs that can interact with the paracetamol. So, paracetamol, first of all, keep it in mind. It is contraindicated. All of the medical personals, that are those ones that are listening to my videos, please, I request you to like and subscribe my channel, so that you can get info about most many of the other medications or case discussions that I'm planning to make it in the future, so that you apply it into your practical experience. I'm also thinking to make uh, a separate playlist in which I can have a consultation with different medicinal doctors, ophthalmologists, physicians who are in interaction with me, who are my mentors, who are my seniors, so that I can help you through this social media to know about most of the practical cases and most of the methods that we do wrong, and some of the common mistakes that we do in our daily life. I also plan to uh, help out the people through Urdu videos, so that our patients, our public can get information through it. So let's first talk about paracetamol. Paracetamol is contraindicated when you have kidney issues, when you have acute liver inflammation, acute liver failure, acute kidney injury, or due to hepatitis C, B virus, you are having inflammation in the liver that is fairly. Because the paracetamol, it get metabolized by the liver. So one thing we have to keep in mind, whenever we are practicing medicine, we have to keep it in mind that which medications are being uh, metabolized by the liver, and which medications are metabolized by the kidney. Like in the case patient on dialysis CKD, in most of the cases we have to reduce the dose, and most of the medications we have to avoid when the patient have kidney issues. Similarly, Paracetamol is avoided in both these conditions, liver and kidney failure, and especially the acute liver inflammation, as I mentioned, due to any condition. So, paracetamol, it can have drug interaction with the common of the medication that we use in our practical life as well as in the wards. Like if someone has fever as well as vomiting, the person takes together the paracetamol as well as metoclopramide, that is antiemetic, and domperidone. Both are antiemetics. And in the pediatric ward and the medicine ward, we use both these drugs together, right? As a result of it, what happens that domperidone and metoclopramide, it do what? Domperidone and metoclopramide, it increase the absorption of the paracetamol. So you have to avoid giving the paracetamol together with metoclopramide or domperidone. At least keep some of the uh, difference in the medication that you're giving at the same time. Similarly, cholestyramine, the drug we use commonly, we have to be vigilant that cholestyramine can interfere easily with the absorption of the paracetamol if it is given within the 1 hour. And the next one is the imatinib. These are the most commonly drug. I I was thinking to mention these drugs today during my general walk in the hospital. So we have to be careful that the medications that we use should not be interacting with the other medication. Always look for metabolism pathways as well as the things that we are aware of these medications. So let's talk about one of the things that we have to keep in mind. And the thing is that paracetamol can also interact with the imatinib. Imatinib, when given with the paracetamol, can interfere with absorption of the paracetamol, as well as imatinib can lead to overdoses effect or toxic effect. So be very careful that if someone is taking a imatinib daily, do not allow that person to take paracetamol on the regular basis. So these are some of the points: the drug interaction of paracetamol and other drugs with that, like antiemetics, cholestyramine, and imatinib, immunosuppressive drug. So there are a long list of medications that can interact with the paracetamol. According to one of the list, there are total 169 drugs that interact with paracetamols, and there are 123 brands that have paracetamol in their names. So 69 of the drugs have major drug interaction, and rest of the drugs have minor drug interaction with the paracetamol. So I hope so this video will be very helpful for you. You have learned something from this video through my channel. Thank you so much for hearing this video. Allah Hafiz. Take care.